Hey guys, welcome to my channel medschool. How are you guys? I hope you all are doing great. So, without further ado, let's get started. So, today's topic is cardiovascular pathology, in which there is aneurysms and dissection. So, let's just jump right into it. What is an aneurysm? It is localized abnormal dilation of blood vessels or the heart that may be congenital or acquired. There are two types of aneurysms, true aneurysm and false aneurysms. True aneurysm is an aneurysm involving an attenuated or intact arterial wall or thinned ventricular wall. This means the muscular wall of the artery is basically intact and there is no injury to the muscular wall and as well as to the ventricular wall. These true aneurysms are seen in atherosclerotic, syphilitic, or congenital vascular aneurysms. There are two forms of true aneurysm: secular aneurysm and fusiform aneurysm. In secular aneurysm, it's a spherical outpouching or mainly bulging of one side of the arterial wall. And in fusiform aneurysms, there is circumferential or diffuse dilation of the long vascular segment. And secular aneurysms are mostly contain thrombus in the outpouched area of the muscular wall, whereas fusiform aneurysms don't mostly contain any thrombus, hence leading to not clinically significant or less harmful. False aneurysm. It's a defect in the vascular wall leading to an extravascular hematoma which freely communicates with the intravascular space, thus forming a pulsatile hematoma. Basically, it means moving out of the blood moving out of the blood vessels into the interstitial space, and it's only prevented by the movement is prevented by extravascular connective tissue or the perivascular soft tissue, thus forming a hematoma. Now, why pulsatile? Pulsatile because the hematoma shows pulsatile movements because of the pressure changes from systolic to diastolic. Dissection. It arises when blood enters a defect in the arterial wall, mainly a tear in the intima, and tunnels between its layers. It means the movement. There is a tear in the tunica intima of the blood vessels, and that tear is a gateway for the blood to enter into the walls of the blood vessel, and thus forming dissection. It doesn't have usually need to be a tear in the intima. It can also happen when the vasa vasorum, that is the vessel of the vessels, rupture within the tunica media, thus forming a pocket of blood within the blood vessel wall without actually being a tear in the tunica intima. Pathogenesis of aneurysm. Aneurysms can occur when the structure or function of the connective tissue within the vascular wall is compromised. Few examples of inherited defects. The compromisation of the vascular wall, there are a few examples for that. These are the intrinsic quality of the vascular wall gets poor. What do you mean by the intrinsic quality of the vascular wall? Intrinsic quality means the quality of the collagen or the elastin which is there in the vascular wall gets poor. Some of the syndromes which have this lower intrinsic quality are Marfan syndrome. Now, Marfan syndrome is characterized by defective fibrillin synthesis. Now, fibrillin is a protein which is essential for the TGF beta activity. TGF beta, transforming growth factor beta, is a protein, essential protein which helps in cell growth, cell proliferation, and cell differentiation and cell death, which is apoptosis. This TGF beta is necessary for the synthesis of collagen and elastin, and as the fibrillin protein is responsible for its activity, the defective fibrillin synthesis leads to defective collagen and elastin synthesis, and hence leading to aneurysms. The second syndrome is Loeys-Dietz syndrome. Loeys-Dietz syndrome is characterized by mutations in TGF beta receptors. As cells won't be receiving proper signals or stimulation for synthesis of elastin and collagen, there would be defective synthesis of elastin and collagen 1 and 3, thus leading to formation of aneurysms, and the individuals in which this syndrome exists, there might be very high risk of rupture of aneurysms, as they are very poor intrinsic quality of the vascular wall. Thus, even a small aneurysm can be a major lead to catastrophic consequences. The third of the syndromes is Ehlers-Danlos syndrome. Now, this is characterized by type 3 collagen defective synthesis. As you see, collagen is necessary for the stability and strength of the vascular wall. As there is defective type 3 collagen synthesis, this Ehlers-Danlos syndrome also leads to aneurysms. Now, nutritional basis for aneurysm formation. Vitamin C deficiency leads to aneurysm formation, which is an example for nutritional basis for aneurysm formation. Vitamin C is essential for the hydroxylation of collagen, and this hydroxylation of collagen determines its stability and strength. And as you can see, the vitamin C is responsible for its hydroxylation, regulates the hydroxylation. The deficiency of vitamin C, as occurs in scurvy, can lead to defective collagen and hence forming aneurysms. The second is the balance between collagen synthesis and its degradation by inflammation and other proteases. MMP and TMP. MMP is matrix metalloproteases and TMP is tissue inhibitors of metalloproteases. MMP is an enzyme or a protease which degrades collagen and all other substances like proteoglycans and elastin, everything which is present in the muscular vessel wall, basically leading them to weakness of the muscle walls. And TIMPs, or tissue inhibitors of metalloproteases, are the inhibitors of MMPs. And there's a specific balance between these two for the normal functioning of the normal sustenance of the vessel wall. And when this balance tips off, there are two consequences. Either there is increased buildup of elastin and all the stuff that was making the vessel wall much more, stable and strengthful. There is much more buildup of those substances. Either that's the consequences, or there is a second consequences leading to weakening of the vessel wall, because TMPs don't actually function in that consequence, and MMPs function a lot more, and MMPs degrade all those elastin, proteoglycan, and collagen, which was there in the vessel wall, thus leading to aneurysm formation. And the risk of aneurysm formation in the setting of inflammatory lesions like atherosclerosis may be associated with MMP or TIMP polymorphisms. In atherosclerosis, there is basically buildup of macrophages, and macrophages are bound to produce MMPs, which lead to weakening of the vessel wall and aneurysm formation. The third thing here is the vascular wall is weakened through loss of muscle cells, smooth muscle cells, or the synthesis of non-collagenous or non-elastic extracellular matrix. Now, this means the degradation of the muscular wall, smooth muscle cell, which produces collagen and extracellular matrix for the vessel wall. The loss of smooth muscle cell will indirectly lead to loss of the collagen in that case. And the synthesis of non-collagenous substances or non-elastic extracellular matrices occurs in instances like atherosclerosis, where there is a plaque formation, and hence there is less blood supply to the intima layer, as there will be a lot of distance that the oxygen and the nutrients that has to be traversed by the oxygen and the nutrients to reach intima from the lumen, as there will be thickness. The plaque, atherosclerotic plaque, will be in the way of normal blood and the intima, tunica intima layer. Now that makes medial ischemia, that causes medial ischemia. And in other instances, like in systemic hypertension, the increased pressure in the vasa vasorum will lead to outer medial ischemia at the outer media part, and thus causing lack of blood supply to the smooth muscle cells, lack of collagen synthesis, and there it is. And this causes buildup of non-collagenous substances, and this causes degenerative changes in the medial wall. And these degenerative changes, like smooth muscle loss, and leads to scarring and inadequate extracellular matrix synthesis and production of amorphous ground substance called glycosaminoglycan. Now, this situation is histologically called as cystic medial degeneration. As you see in the diagram below, A diagram and B diagram. B diagram is a normal human vessel wall, blood vessel wall. Normally, as you can see, there is a proper layered elastin of elastin tissue, proper regularly layered pattern of elastic tissue. And as you can see in the A diagram, there is elastin fragmentation, and at the places of and this elastin fragmentation creates a spaces called as cystic spaces, in which there is proteoglycan filled in. The proteoglycan gets filled up in the cystic spaces, leading to weakening of the vessel wall and thus forming aneurysms. Now, this fourth cause is a very rare cause for aortic aneurysms. This is tertiary syphilis. In the late stages of syphilis, the syphilis shows a predilection for small vessels, such as those of thoracic aorta, the vasa vasorum of the thoracic aorta, in which it causes aneurysms, and this leads to aneurysmal dilations, and also sometimes involves aortic valve annulus. The two most important causes of aneurysms are atherosclerosis and hypertension. Now, atherosclerosis is the most common etiology for abdominal aortic aneurysms, whereas hypertension is the most common etiology for ascending aortic aneurysms. Now there are other factors in play which causes aneurysm. These include vasculitis and trauma and infections. And the aneurysms which are caused by infections are called as mycotic aneurysms. Now, there are some causes, or how do these mycotic aneurysms come to happen? There are some causes like embolism of the septic embolization of a septic embolus. It basically happens in few cases like infective endocarditis, in which the embolus from the heart gets transferred to the ventricle or to the blood vessel through circulation. And it happens also by the organisms which are already present in the blood circulation, and they just go directly infect the arterial wall and thus causing mycotic aneurysms. This is just a part one of the video of aortic aneurysms and dissections, and part two will contain about abdominal aortic aneurysms, thoracic aortic aneurysms, and aortic dissection in detail along with the morphologies.